Happy Friday, all. I'm glad to see everyone here. Thank you for being with us here today. I'm Liz Flannery. I'm the Director of Education and Leadership here at the American Institute of Dental Public Health, and we're thrilled to be here with you today to talk about veteran oral health in Oklahoma. I'm going to pull up our slides to get us started. And as folks come in, we invite you to be on camera, to be fully present. This is a session that's designed to be engaging, so we hope to hear from all of you throughout the session. Okay, and I have Rahel Michael, my colleague from AIDPH, is here with us today as well. And if you are having any issues with Zoom, you can pop that in the chat to Rahel. And if you have any questions along the way, you can pop those in the chat, and Rahel will be sure to make sure she interrupts me and lets me know we have questions and we get those answered. Okay. I think we also have some folks still coming in from the waiting room. So I'll just double tap Rahel if you're able to keep an extra eye there. But in the interest of time, we will go ahead and get started. Okay. So today we are going to do some housekeeping and intros. We are going to look at veteran oral health at a national level before we dive into what veteran oral health in Oklahoma looks like specifically. As I mentioned, we have time woven throughout this session to hear from you. We want to hear back from you if the data is reflective of what you're seeing in your work in the state, if there are resources we can provide, additional resources we can provide to help you with your work. And we also want to give you time and space to connect with your colleagues in your state and share the work that you're doing with each other and talk through opportunities for connection and collaboration. So as such, we invite you to introduce yourself in the chat. We would love for you to share your name, your pronouns, what brings you to veteran oral health, the type of work you are doing. We also want to share that we are recording this session. The recording, the slides, all of the materials from today's session will be available in our academy afterwards. That means you can go back and reference. It is where you will go to request your CEU if that's something you're doing with the session here today. And also all of those resources will be available for you to share out with other colleagues who might not have been able to attend live, but are interested in the session. Okay, and again, I mentioned if you have any questions about Zoom, you can ping Rahel. And also, if you have questions throughout the seminar, you can post those in the chat as well. So as I mentioned, we have several different ways we want to engage today. One platform we will be using is Slido. If you haven't used Slido before, it's fairly straightforward. You can access it a few different ways. If you have your phone, you can scan the QR code here. If you're on your desktop, you can plug in the website and use this code here. Rahel will also plug the code and the website into the chat so that we can reference it throughout. Once you pull it up, I recommend you leave it up because we will use it several times. Okay, just going to give a second to make sure folks are able to scan or plug in the code. As I mentioned, we have CEU attached to the seminar here today. If you complete the whole session live, you are eligible for a CEU. If you are watching this asynchronously, there will be separate instructions available in the course materials where you can also access your asynchronous CEU. These are our learning objectives that are attached to that, and these were also included in our registration materials. Okay, so we're going to get warmed up with Slido. If you want to toggle over to that website that we shared a minute ago. Again, it's in the chat if you didn't open it before. We want to get started by hearing about what brought you to today's session. Are you here to learn, share, connect, or act? Or maybe it's all four of those. And this will give us a good level set. All of the above, love to see it as we dive into our materials here today and make sure that we hit the right points for all of you. Okay, I'm seeing all of the above. That is great. We'll have to do a check-in at the end and see what you've learned. Make sure you're ready to act and share all of those pieces. Okay, We are going to leave this poll up. If you have, I'm going to toggle back to the slides, but if you haven't had a chance to answer, please do so. We really want to hear from you and make sure that we are hearing from stakeholders in your state. I see folks adding learn. That's fantastic. Something that I should have mentioned, another part of this seminar series that we're doing, we have a compendium report that includes a summary of resources discussed, options discussed in each state, so that states who are looking to act can go and look at those best practices that were shared on other conversations. We have that report on our Veteran Oral Health page as well. Okay. I am your presenter for today, and I do not have any disclosures or conflicts of interest to share. Again, I mentioned I'm the Director of Education and Leadership here at AIDPH, and Rahel Michael, my colleague, is here with us helping administer this session. And we want to say a big thank you to Dr. Nicole Reynolds, who is also on this call, the Dental Health Service Director at Oklahoma State Department of Health, who really was critical in making sure that we shared this information about this seminar out with folks in the state and allowing us to be here today. So thank you, Nicole, and we're excited that you're here with us today and excited to hear your point of view on our discussion points. Okay, so we're going to go back to Slido again. As we are getting started, we want to know, what do you believe are the top priority areas for veteran oral health in your state? And again, this will really kind of help us look at what you're learning, what you're striving to learn in the session here today, and make sure that we tailor our content accordingly. So it could be access to care, oral health literacy, workforce development, policy advocacy, integration with general health care, oral health literacy. Okay. Access to care. Okay. I was thinking it might be different this time, but I think we are well over hosting this seminar in 50% more than we've visited more than half of the countries in the half of the states in our country, excuse me. We can tell it's December. And access to care has been the top concern, top priority area in every single state to date. So you are not alone. And I'm excited to hear some more specifics about that as we go along. And oral health literacy is typically up there as well. So we're going to talk about some ideas for these pieces. Again, if you haven't yet responded, please continue to do so. Even though I'm back to slides, we will leave those polls open. Okay. So who are we as AIDPH, and why are we here talking about veteran oral health today? We are a 501c3 nonprofit. Our mission is to empower our community to advance oral health through science, education, and advocacy. You will see those three pieces coming together as we talk about our research and the work that we have done in veteran oral health, as we share out the data with our community, with our dental public health folks about you in Oklahoma. And we talk about advocacy opportunities of what we can do with this data. We do this work because we have a vision of a justice-oriented oral health system. At AIDPH, we have 4 communities of focus. That includes LGBTQIA+ people, veterans, people with disabilities, and people living in rural communities. Understanding, of course, that there's intersectionality on those 4 communities. For example, today we're talking about veterans, and approximately 30% of veterans report having a disability. Approximately 25% of veterans live in a rural area. That's something that we'll really talk a lot about today as we dive into the data and look at that rurality piece and how it can compound the disparities that folks face. All of our communities of focus have a common experience of historical exclusion and marginalization from healthcare systems, and that is why we focused our data and research there to share out the data, as well as data-informed strategies of how we can reduce those barriers. Okay. We want to say thank you to CareQuest Institute for Oral Health for being the funder for this program. They are why we're able to be here today giving this seminar. We have a long-standing history of working with CareQuest in many ways, but particularly in veteran oral health. And this is just a timeline showing the work that we've done. Our co-founder and executive director, Annalise Cothran, shares a story of how we started research in veteran oral health. She herself is a spouse of a veteran, and CareQuest came to her and said, "What do we know about veteran oral health?" And she herself says she was embarrassed to say really nothing. It maybe fit on half a piece of paper what we knew about veteran oral health. And we really saw that as a call to start with research. We did that in a community informed way. We connected with veteran service organizations and really partnered with veterans themselves to have them lead the way and for us to bring in our research expertise to partner with them and conduct this research. We've now published several papers on veteran oral health to include the state profiles that we're here talking about today. We've had an opportunity to have Hill days and advocacy opportunities, leveraging this data to really, again, look at these disparities and reduce them over the past several years. And here we are sharing the state profiles. And part of that is we developed these tools. We were hearing over and over again, this is what veteran oral health looks like at the national level. What does it look like in my state? That was our call to develop out the state profiles. And then we really determined that we needed to make sure we were having a conversation in each state to ensure that stakeholders understood these tools were here, and also to hear from you about what else can we do with the data, with the information that we have that helps you with your work. Okay. So what does veteran oral health look like nationally? Starting with a national overview, so we know the broad strokes before, again, we dial into Oklahoma. Now, this might be familiar to some of you, but what we found doing this work for many years now is that many people, including veterans themselves, often aren't fully aware of how VA medical and dental benefits work. Um, so that's why we like to begin by setting the stage with a clear picture of what's actually available through the VA and what veteran oral health looks like at the national level. There's two key points I'm going to make over the next two slides. So the first one here is that eligibility for medical and dental care through the VA isn't set through the VA itself. It's determined by Congress through a federal law called Title 38. And that law outlines what is covered, what care is covered, who qualifies, how much it costs, and where it can be delivered. And because of that, any major change, like expanding dental coverage, requires congressional action. It's not just a policy update or a rule change. It involves passing new legislation and securing federal funding to support that new legislation. So when we're talking about the limitations in access to dental care for veterans through the VA, it all ties back to that federal level. At the same time, I also really want to point out that that doesn't mean we can't take action and impact change at the local and state level. It takes getting educated, like what we're doing here today, and then collaboration with our local communities. And we're going to share out several examples of state-based work that has really made a change in some states and examples that we think could be well replicated in other states. Okay, so that was our first major point is eligibility isn't set by the VA, it's set by Congress. The other major point we want to set here, if you come away with nothing else from this seminar, is that most veterans are not eligible for dental care through the VA. We find over and over again that this is very surprising to folks. I think people typically think if people are getting their care through the VA, if veterans are getting their care through the VA, that must include dental, because as we all know, oral health is health, right? So looking at this graphic, the top row of people you see here represents all 18 million veterans living in the US today. The lighter colored half shows the veterans who either receive care outside the VA or aren't eligible for VA health care at all. And then as you move to the left of this graphic, the darker blue section represents the nearly 9 million veterans enrolled in VA healthcare. But of those, only a tiny fraction, the small blue and red segment, is actually eligible for dental care through the VA. So what that means in practice is that veterans might go to the VA for a medical appointment, get treatment for a chronic condition, but they're leaving still dealing with untreated dental pain, and because they're not eligible for the dental care there. So the other point here is even among the 1.8 million veterans who are eligible for dental benefits, only about a third of them are actually using those dental benefits. We need more information here to really look into that utilization rate, but we suspect that barriers to care and lack of awareness play a big role in that low utilization rate. And we'll talk a little bit more about that throughout this seminar. The other piece here is that we know that this problem is even worse for veterans living with chronic conditions, where good oral health is especially critical. So we're going to look at that a bit here. Again, looking at the national level, veterans living with chronic conditions like heart disease and diabetes are especially vulnerable to oral health issues. What's even more concerning is that veterans with these high risk, high cost conditions are more likely to lose all of their permanent teeth. And we see poorer oral health outcomes for veterans than non veterans, even if they've seen a dentist in the past year. So, access alone isn't solving the problem. Even when veterans are getting the dental care, many still face the worst oral health outcomes. And a big reason for this is the lack of the integrated care. The chronic conditions aren't being addressed in coordination with oral health needs. And that's frustrating because the VA is the largest integrated healthcare system in the country. They're uniquely positioned to manage complex care for veterans with multiple chronic conditions. But since most veterans aren't eligible for dental care through the VA, they're missing out on that critical coordinated care, which leaves major gaps in their overall health outcomes. So looking at this a little more specifically, this is from research that we conducted in partnership with CareQuest. It really focused on the connection between chronic disease and oral health. So even after controlling for factors like income, education, and whether someone lives in a rural area, we found that veterans with diabetes were still 40% more likely to be edentulous, meaning they have lost all of their natural teeth, compared to veterans without diabetes. And that's a really powerful indicator of just how strongly chronic disease can impact oral health outcomes, even when other risk factors are taken into account. So similarly are the findings related to heart disease. Veterans with heart disease were 30% more likely to be completely edentulous compared to veterans without heart disease. And that reinforces what we're seeing across the board. Chronic conditions like heart disease and diabetes have a significant impact on oral health outcomes for veterans, even beyond other contributing factors. So looking at this at a systems level, what we really want to highlight here is this isn't just about poor oral health outcomes or reduced quality of life. Obviously, those are very serious concerns, but it's really about the broader health impact and the cost of care. When dental care is managed as part of an integrated healthcare system, like what the VA could offer if dental coverage was expanded, there's a clear opportunity for cost savings, especially for veterans with chronic conditions. So, some of our research shows that for every $1 invested in dental care as part of diabetes management, there's a $1 savings in related medical costs. And with heart disease, it's more striking. For every $1 spent on preventative oral health care, it can result in $2 saved in heart disease management. So at that point, dental care isn't just a health benefit, it's really paying for itself. And I want to take particular note here that this is important context to keep in mind as we look at chronic disease trends in Oklahoma and consider what solutions might look like there. So this is national, but keep this kind of cost savings healthcare system piece in mind as we move into your data. This is a community spotlight on veterans. Again, data that was collected in collaboration with CareQuest. This data comes from BURFIS, the National Survey of Veterans, administered in 2021, and from data assessed through the VA. Just really looking at kind of the stark differences and disparities that rural veterans face. Okay. We're sharing this quote here. We strive to conduct our research in a mixed methodology whenever we can to really pull that first person perspective into our research and highlight that the impact of the data that we're looking at, understanding that behind those numbers that we're looking at, there are people. There are people behind all of those numbers and really wanting to pull in our community voice. And this is a working age veteran living in Maryland, unable to afford care and really sharing the impact of that and asking for help. Um, they don't qualify for a VA dentist, and they're asking for help. Okay. So the research that we're talking about today, all of our research on veteran oral health lives on vetdentaldata.org, and we'll pop that in the chat for you as we come up to the state profile piece. If you haven't looked at your state profile, you can pull that up there. And go along as we dive into that. I'm sharing some screenshots here to really kind of look at the other pieces of vet dental data and talk about what you can do. We have several interactive dashboards, and we want to highlight those as tools that can be useful. So there's interactive insights on rural veterans, cost of care, and state-based indicators. We have an entire tab dedicated to rural veterans, again, because those two pieces compound the disparities faced, and we know that rural veterans disproportionately live in rural areas in most states. I want to point out here that when we look at the rural veterans, the data aren't available from MEPS, which is the Medical Expenditure Panel Survey, on a state level, but they can be evaluated by region. So if you're looking for that information, you can get a sort of proxy for state level data with this dashboard. Okay, and when you click on the rural tab, it will take you to an interactive dashboard on rural veterans. And across each indicator, it's clear to see that rural veterans delay dental care due to cost. They spend more out of pocket on dental care, and they struggle to find accessible locations for dental care. Okay. Again, looking at some of the insights we can get from these dashboards, and noting that rural veterans also feel more impact from lack of access and utilization to dental care, often citing that the state of their mouth or teeth is embarrassing compared to non-rural veterans. And rural veterans also struggle more with a functional dentition, which likely leads to the data points we see around increased cost of care and higher emergency department use. Again, this is highlighting our research publications, all available on vetdentaldata.org. And what you're seeing here is just a snapshot of the research and tools we've developed to help organizations and folks like you who are working in oral health and veteran oral health. We really strive. Our goal is to provide access to clear, tangible data about veterans. So again, if you have feedback, we would love to hear it about additional tools that you may need that would help you with your work. We are never doing research for research's sake. Our goal is to make it accessible, open, and available for people to use it in their work. So this is free to use, open access. Okay. And again, if you would like, we are now going to get into Oklahoma data here. If you would like to pull up your state profile, you can go to vetdentaldata.org. You can go to publications and plug in Oklahoma and pull up the state profile if you would like to. Okay. We're about to get there, but before we do, we would like to hear from you one more time. We would love to have you share one word, naming what you think your state's biggest challenge is for veteran oral health. If you toggle over to Slido, I'll pull it up here. There is a QR code you can scan with your phone. You can plug in the website and the code and share out what you think your state's biggest challenge is. Access. Okay. See, access is bigger, so multiple people must have put that in. Cost, access, inability to find care within reasonable distance. Okay. Cost. Okay. And if folks want to share here or if they want to post in the chat, I see that some people are putting distance, that's an access piece. Cost multiple times, that's an access piece, access in general. If you have other thoughts around that access, whether it's provider shortages, insurance coverage. I invite you to share that either here or in the chat as well, specifics that you're seeing here. Engagement, if someone wants to expand on that, I would love to hear more about that if that's ties back to that oral health literacy piece and veterans themselves understanding the importance of getting care. Embarrassment, yes. Fear, yes.
Hi, Liz. This is Patrick at Mobile Smiles, Oklahoma. I put engagement because I wasn't really sure how to put one word.
Yeah.
Finding these folks, getting communication to them, getting
Hmm.
them where the location is where we can help them. In my instance, a mobile location,
Yeah.
and getting them to come sit in the chair. So I try to wrap all that up engagement, but sometimes they're just
Okay.
difficult to find. We had a veterans event not too long ago, and we were hoping for several hundred. We had like about 75. So
Got it.
sometimes it's hard finding those folks and getting them to engage to that we all know they need help. How do you help
Hmm.
someone help themselves? So
Right.
I didn't know how to encapsulate that in one word.
Yes, and I appreciate that. I'm giving you mixed messages, asking for one word and then asking you to expound. So I appreciate you sharing. Thank you for that. And I would also invite you, Patrick, if you have links to your programming and want to share those in the chat. Again, to the stakeholders, we can include that in our follow-up email. We can include it with our post of information. Um, our goal is always to allow folks to kind of connect with other stakeholders in the state. And very often it's folks with a program like yours needing to get the word out. And people might either be able to share it with their networks and or have suggestions on folks to connect with on how to reach the veterans that need these services. So if you have anything you want to share, I invite you to do so.
Great. Thanks, Liz.
Thank you so much. Okay. Thank you everyone for participating. Again, I'm really, really seeing that theme of access. So let's dive into it finally, and look at these pieces. Okay. So this is what the top of your profile looks like if you haven't seen it before. We open each profile with some context of what's happening in Oklahoma, how it fits into the bigger picture nationally, much like what we just did um, at the top of this seminar, especially when it comes to dental care and access to the VA. So again, like we did on this seminar, we always start with the key point that most veterans are not eligible for dental care through the VA. And so if you are in your community and you're having a conversation with funders, policymakers, decision makers, you're trying to launch a program, you're trying to get an organization to share out your information, like Patrick just mentioned, really start there. Um, I myself feel like a broken record, but I have been doing this work with AIDPH, this specific seminar for several years now, work in veteran oral health, and I actually did not share, but I happen to be the spouse of a active duty service member. Um, so it is an area I am familiar with and over again in almost every seminar, every conversation, even with folks that we work with professionally at AIDPH, it is a surprise to people that most veterans are not eligible for dental care. So I really encourage you to start there. If you're having a conversation, we kind of level set and give that context at the top of these profiles.
Hey
Um,
Liz,
yeah,
I had a quick question. I didn't know
sure.
if you could maybe expand a little bit on how it is decided which veterans are deemed eligible for dental benefits with the VA or not. Like you say, it was surprising to me to see, how few really are eligible, but can you tell us a little bit more about that piece?
Yes, I absolutely can. And I will give the caveat that I will give a broad overview because it's a pretty detailed, complicated process and system. And I am by no means an expert in the details of it. But broad strokes is that when folks come out of active duty service, they are given a disability rating. And that was something also in these conversations that I thought I have to take my Army wife hat off and explain disability rating if you're not in a military connected community might not make sense. We think if someone has a disability, it's a disability and that's that. But folks get a disability rating as veterans, and is basic, and that's where I'm saying it's very detailed, complex. I'm not an expert of how what everything adds up, but it can be, if someone has PTSD, that could potentially be 100% disability rating. It could potentially not be, but someone could come away with a major injury, but also maybe a niggling shoulder injury because they did X, Y, and Z throughout their service years, and kind of all of these pieces. They might have hearing loss. My father-in-law has a disability rating for his hearing loss. It can kind of be a bunch of conditions that people have that add up into a disability rating. And the long and short of it is the number one way that folks can be eligible for dental care is to have a 100% disability rating. You either have to have a 100% disability rating or a service-connected injury that involves your mouth. Again, it's a little more nuanced than that, but the kind of broad strokes are those are the two ways that people can have um, get dental care through the VA. The other piece of that is that so our numbers actually adjusted the amount of people who are eligible from when we first started doing the seminar to doing it now, actually bumped up a bit in the past year. And that was because of the passing of the PACT Act. And the PACT Act didn't increase dental eligibility. It didn't give additional pathways, but it increased the number of people who became 100% disability rating, and that in turn increased the number of people who are eligible for dental benefits. So I share that, one, just for an environmental understanding, but two, ways that legislation and changing can make incremental changes. Still the majority of people aren't eligible, but more are, as kind of a sidelong benefit to the pieces that came with the PACT Act. So just understanding change takes a long time, but we can get there if we keep going and keep making those incremental pieces. Do you have any questions? Follow-up
No,
questions?
thank you. That's really, really helpful to have that background. Thank you.
Yeah, absolutely. Okay, so the other piece that we've included in the profile here is data on where veterans live across Oklahoma, especially counties with high concentrations, and pulled in whatever we could find on rural veterans. So you'll see here, there's a broad map that you can look with a key, and then we pull out the top 3 counties. So again, as you guys look at the data in your state, it can really help you to kind of hone in on where to focus. And the where might be a geographical where, or it might be an issue area where. And so we hope that that geographical information really kind of helps have you get an assessment of access. Looking at where VA clinics are in your state compared to this map and where veterans are located can also give you insight into that access piece. Okay. So then we look at Oklahoma to national averages because without that context, numbers don't mean much, right? So if you're sharing this with a decision maker, they might not understand if 11% is high or low or somewhere in between. And so again, that's why we really included the national average. So you have a quicker understanding of where Oklahoma stands in the broad scheme of things. You can also compare across states if that's helpful. That's something we recommend. We have a state profile for every state in the country. So if there is a state that you know is similar in demographics or political landscape, whatever it may be, looking at how they're standing and what their numbers are can be helpful as well. Okay. So earlier we talked about chronic disease, those high cost, high risk conditions like heart disease and diabetes that are closely connected to oral health. And because those connections came through strongly in our research, we wanted to make it easy for you to highlight them when you are looking at solutions, talking to decision makers, etc. So in this section, you'll find data on heart disease, diabetes, insurance status, and indentualism, all compared to those national figures. So we see the percentages, and then we ranked each state across those 4 key outcomes. So you'll see where Oklahoma falls compared to all 50 states, and that's what those numbers here across the bottom are. Okay. If you are very interested in the data and the methodology and want to dig into that, we have the specifics of all the rankings, et cetera, listed on vetdentaldata.org. Okay, and then we get to our grade portion, and we really chose a report card. Again, our goal is to make pieces as accessible and usable as possible. So we designed these state profiles as a tool that you can bring to a layperson. It doesn't have to be a person in clinical care. It doesn't have to be someone who's a data analyst or even in public health. We really took the data and tried to put it into a graphically appealing, easy to understand format, and that is where the report card piece came in. So taking a look at where your state, is it succeeding and might need some work can be really helpful. I think our eye goes directly towards what the worst piece is and is like we need to kind of work there immediately. But I think it can really be a helpful tactic to look at maybe where you're doing a little bit better and find success stories there. Similarly, if there are states that maybe there is a neighboring state that you have great colleagues in or great connections with, or there is a state that is very similar to yours in a variety of ways, looking if they have a successful grade in something, connecting with folks in their state and asking, what was your pathway to, what are you doing to get this good grade? That can really give some best practice stories of tactics to take to address those challenges. Okay, this is another screenshot of our dashboard and just sharing. So you can go and look up a state profile, but you can also go to this map and hover over for a faster look at kind of many states at once to see a quick snapshot of their standings, and that might give you insight of certain states to pull up their more in-depth profile. Okay. All right. I would love to hear from folks. You can pop it in the chat or you can come off mute and share. That was a lot of information. We also know when we're looking at publicly available data sets, it's limited, right? So there might be challenges that you're seeing in your state that aren't represented in the data we just looked at. So I'd love to hear, is there something you're seeing in your state that's not represented here or that we haven't talked about? Okay. And it's okay if it is not. I am going to, let's see. Okay. I'm going to keep going through slides, and Rahel, I will just ping you to interrupt me if there's pieces that folks share in the chat. Okay, great. Um, so again, we just went through a lot of data and a lot of details. I hope it was informative, but really we want you to come away from this session with next steps and feeling like you can leverage this tool in your work. So we're going to talk a little bit about how we can use these state profiles. So we mentioned advocacy, speaking up and sharing this information. And I just want to note here at AIDPH, we really see advocacy as a full spectrum. And so I think when folks hear advocacy, they often think legislative change going to the state legislature. And that is certainly one part of advocacy that's important and great. But advocacy we have kind of that big P legislative change and small p. It might be something like making a small change in your dental office, sharing it as a start with your community, just amplifying this need in your community to start. All of that counts as advocacy and is all an important part to gathering momentum around advancing change for veterans in your state. So in that vein, educating folks. Again, many people working in healthcare or veteran services don't know how stark the oral health gap is. And that's where education really comes in. You can use this profile to lead a short talk. It could be at your organization staff meeting. If you have in-services, it could be something like that. If you volunteer with an organization with students, it could be sharing it out there. We really think that when stakeholders are informed, they become allies, and that's how we build momentum. There's also opportunity to collaborate across silos. So for example, something that comes up over and over again is looking at transportation. That is a huge piece of rural access. I think it was even mentioned earlier. Maybe there's an organization in your state or your county that is already working on transportation for other services. Is there an opportunity to collaborate with them and bring in oral health connection with that organization? Mental health, food access, those are other organizations. I think fear came up. Trauma informed care is a piece that comes up on these seminars over and over again. There might be other organizations like a DV organization who offers a trauma informed care training that could be helpful to your office in addressing some of those fears, or another type of organization that's doing something around that. So really thinking through about what's happening in your community and what organizations might be smart to collaborate with. Okay. The data can be a tool for strategic thinking. So, using the profile again, helping you to decide where to focus. It might be that actual where, looking at those counties with the highest population, or it might be an issue area where. It can also help you make the case for why you're investing resources where you are. And if you're doing evaluation or reporting, this data can really give you a baseline of here's where we're started and here's where we're trying to shift to. So to that end, talking a bit about how this profile can bring in resources. We know that grant makers and funders want to see data and they want to see it grounded in the community. And this profile gives you that start. You can really use it as the problem statement of a grant request or to show gaps in care. And you can also use it to cite it as a foundation for the solution you will address. So as a benchmark, if you're doing pre-post testing, if you're measuring kind of the starting point, it can really help you measure outcomes and deliverables of a grant program you might be pursuing.
Hi, Liz. I'm Nikki. I'm from the Delta Dental of Oklahoma Foundation. I just want to reiterate what you just said, because every grant application that we get in, that is something that our board looks at very carefully. So highlighting a need with numbers is a great way to get money from organizations like us.
Thank you, Nikki. That's really fantastic. And I'm so thrilled that you are on the call. It's always wonderful to have the funders mixed in. So I really appreciate that. Okay. Um, so speaking of resources and helping, we have another poll. And I kind of mentioned this throughout the seminar, but we want to be leveraging the data that we have found in our research to best serve the work that you are doing. Again, AIDPH does research to serve the field. So we want to hear from you about what additional tools would be most helpful to your work. How can we translate our research into solutions for you? So it might be education materials, policy briefs, research findings, training modules. If there's something else, please feel free to chime in. Okay, and based on the conversation and the feedback that everyone has shared before, I take education materials to perhaps meet with veterans themselves on that oral health literacy piece, on that understanding resources piece. But if there are other audiences for those education materials, would love for you to pop those in the chat too. Research findings. Okay. All right, I will let folks, again, please continue to answer if you have not already done so, even as we go back to slides. Okay, so we mentioned that we are going to share success stories and that we can still take action at the state level, even though access through the VA is determined at that federal level. So let's talk about some great examples of some policy advocacy that we've seen. So Florida passed legislation creating the Veterans Dental Care Grant Program within the Florida Department of Veterans Affairs. It was designed to provide dental care to veterans living in Florida. And the way it works is that the department will partner with a statewide direct support organization to administer the program. and the organization distributes grants to nonprofits with a strong track record of serving veterans. And then those nonprofits deliver care to eligible veterans based on income, service history, and other qualifying criteria. This was fairly new legislation, and it was just started to be implemented in the spring of 2025. And I think kind of fall of 2025, they determined that it was successful and going to keep going into at least the next year. And so this was fairly new to us this year, and we're kind of keying it in of keep an eye out on Florida and this program in the news, or if you have colleagues in Florida, to see how it's progressing. It was an innovative approach and exciting to see it come together. Oregon developed an innovative Medicaid carve-out specifically for veterans who don't qualify for VA dental benefits or traditional Medicaid. Veterans are first screened to determine if they qualify for either, and if not, they're enrolled in a local coordinated care organization, and they receive free dental care through a network of community clinics participating in the program. Iowa, I will talk a little bit more about Iowa in just a moment. AIDPH has had the privilege of working with the Delta Dental Foundation in Iowa, Nikki, working for several years actually now in Iowa, doing more in-depth research and work with stakeholders and to really build up their coalition, build momentum around action to advance veteran oral health in Iowa. Part of what we found Iowa we highlight is that the state uses lottery dollars to fund the Veterans Trust Fund, and that fund provides direct grants to veterans to help cover out-of-pocket health expenses, including dental care. Again, an innovative approach, and something that has seen a lot of success in Iowa. So we really like to highlight that piece. I also think just in this past week, there was some news that came out around some legislative action in New York State. And we can include that article that came out around what's going on there in our follow-up materials. Okay. So again, just looking at veteran oral health in Iowa, we highlight this as an example if your coalition, if your state feels very activated around veteran oral health, as an example of what happens when there is really momentum and coalition building around advancing veteran oral health in the state. So in Iowa, again, we did an in-depth report. Our research team did about a year-long analysis and published a 70-some-odd page report with strategic recommendations for various stakeholders on actions to take. We then held a series of community forums and heard from stakeholders both virtually and in person, hosting a veteran oral health summit, and really looking at those strategic recommendations and honing in on what the best path forward was, what was the most viable given the current environment and where stakeholders were. We have published a summary of all of those, and we have published a strategic plan and an advocacy plan for Iowa's Oral Health Coalition. So if you're interested in that work and kind of understanding a framework of how to build momentum around veteran oral health in your state, we're here to answer questions. You can also take a look at all these resources. Again, they're available on our website on our Iowa page. Okay. I'm just doing a check on time. So I'm going to pause right now and I will just stop and check and see if anyone has any questions about the pieces that we have discussed.
I don't have any questions. This is Nikki again, sorry. But I did want to mention that Delta Dental of Oklahoma does set up what we call urgent care fund grants at different clinics throughout Oklahoma. And traditionally, they specify a certain demographic. So, for example, pregnant women or indigent population, that kind of thing. But we currently have 0 set up for veterans.
Okay.
So if a clinic would like to apply for a urgent care fund grant from us specifically for veterans, we could accommodate that.
Okay, that's fantastic to know.
Yeah, we just haven't gotten that in. So.
Okay. Now, and
Nikki,
so, oh, sorry. Go ahead, Nicole.
well, I just had a quick question for Nikki. So that's great to know that's available. Do the applications for that grant, are you all accepting those year round, or is it something that goes with your overall grant cycle?
That goes through our overall grant cycle, which, as you know, just closed up. But we do sometimes have mid-year funding available.
Okay.
Also, something like that would take a significant amount of setup and paperwork. So if anyone is interested, I would highly encourage them to get in touch with me as soon as possible so we could start working on that for application that opens up in September of 26.
Okay. And that would be available to traditional, like private practice clinics or potentially like an FQHC, anyone?
So I would say an FQHC, a nonprofit. We typically don't give grants directly to private practices, but if, for example, an FQHC like Variety Care or Morton wanted to do that, we could go through them.
Okay, great. Thank you for that info.
Thanks so much, Nikki. And Nicole, you asked the question that I was going to ask, which was kind of the clinics piece and all that. Nikki, I'm assuming you also know a fair amount of folks on this call. It sounds like maybe folks have been in touch with grant writing. If you have contact information that we're able to share out, I would love to grab that from you. If you don't feel comfortable, that's okay. But if
Oh,
it's
sure.
something,
No, yeah, I'll put it in the chat. So anybody
okay,
can contact me and I'm happy to help with whatever.
okay, fantastic. Thank you so much.
Sure.
Okay. Do folks have other questions? Okay. And I'm just doing a check in the chat here, Rahel. I don't think anything came in. I see a volunteer dentist piece of limiting the availability. Great volunteers, but need more. Mobile. Okay. Okay. And if something occurs to folks after our time here today, again, we are always happy to follow up. Follow up via email. We will follow up with the resources we discussed here today, but we are happy to answer questions or discuss further. Okay, I'm going to pull our slides back up. Perhaps I'm going to pull our slides back up. Sometimes they disappear when I pull them down. Okay, there we go. Okay, so again, we talked at the top here today, and folks, the majority of folks selected that they're here for all four. They wanted to learn, they wanted to act, they wanted to connect. So I hope folks are feeling activated. I hope you feel like you have learned something here today. And I know we are at the end of the year. It is a very busy season. So thank you first and foremost for taking time of this busy season and being here today. And I'm going to ask a little bit more of you that you stay activated despite the distractions of the next few weeks. It's a lot of information to take in. We're busy, but I'm going to leave you with one concrete, easy step to take after this session to help us keep momentum, and that's to share your state profile with one new person or organization. If you want to go a step further and share the recording and prompt folks to kind of dive in more, that's great. If you are willing, I invite you to post it in the chat who you're going to share with. That will help us keep each other engaged, encouraged, and accountable to taking action on that. Again, one small advocacy step you can do in taking, getting us started and sharing out. Okay, some housekeeping and next step pieces. As we said, CEUs are available for today's session. Those are hosted on our Academy. We are posting the link in the chat. I'm going to see, sorry. No, okay, I thought I had a screenshot of the Academy. When you go to the Academy, if you have not been before, you may have to set up a username and password. But that will allow you to have access to all our past VRTs as well as many of our other seminars, including our Rural Oral Health Seminar series, which the recordings are posted there as well. You can find upcoming information. We're at the end of the year, so we don't have any upcoming in the next month or so, but we are in the middle of planning our 2026 sessions. If you need end of the year CEU, we invite you to take a look at our Rural Oral Health Seminar series and collect your CEUs asynchronously looking at those. When you land in the academy, you will scroll down to your state, click on there, and you will find your CEU request form. Our CEU request form is attached to an evaluation. Those are very important to us. As I hope you heard today through our information, we're always looking for feedback. We want to make sure we're adjusting and course correcting based on our participants' feedback. If you do not need CEU, we would still love to hear from you on that evaluation and invite you to fill that out. Again, our recordings and resources, what you posted and shared with your colleagues in the chat here today, we will share all of those out. We will send out an email and post that information to the Academy. We will follow up with those links. Another piece that we are working on as our broader veteran oral health work, we are always looking to hear from our community and to lead from behind and sharing our veteran stories first and foremost. As such, we are gathering stories from veterans about their oral health experiences. And we have a veteran oral health storytelling form to collect that. We use that in our advocacy work. It is anonymous. If you yourself are a veteran or you know a veteran who would be willing to share their story, we would so appreciate you completing that form or sharing that form. Rahel is popping it in the chat. And a final note that vetdentaldata.org is always open, and there with our resources, we encourage you to explore and take a look through. And I also wanted to mention that we recently released our initial report of our veteran oral health tour. Again, now that we have been to over 50% of our country, the report reviews successes, challenges, promising practices that we've learned so far in all of the states that we've virtually traveled to. We can post a link to that as well. We will share Oklahoma's summary in that. It is a living document that we add to as we visit new states. Okay, and we leave you with the idea that veterans deserve equitable oral health. So again, I thank you for being with us here today.